in an effort to close health gaps and ensure everyone has access to routine vaccines. Nova Scotia Public Health, in collaboration with the United African Canadian Women's Association, recently held an immunization clinic focused on communities of color, new immigrant and refugee families. Daisy Daphne During is the president of United African Canadian Women's Association, UACWA.
When COVID-19 hit us, we realized that our people, the African people, were mostly affected because there is a low uptake in vaccine.
The clinic was set up right in the heart of the community, providing easy access to essential vaccines for people of all ages. The goal is to ensure that everyone has the opportunity to protect themselves and their loved ones against preventable diseases. Deborah Gannon is the project coordinator of ABSW, another organization on ground to support this initiative.
We want to ensure that no one is left out or that they have access within a reasonable travel distance to obtain this service.
Healthcare professionals on site are working tirelessly, not just to administer vaccines, but also to address questions and concerns from the public. Michael Monarchy, who migrated to Nova Scotia from West Africa, is one of the beneficiaries of today's immunization clinic.
I had the alternative of taking either the Pfizer or the Moderna, and she explained the difference between the two of them. But the options was up to you, you know.
Community Update spoke to more community members who came out to participate.
I think it's very important that we get the vaccines that we need because there's so much diseases out there that we need to protect ourselves as well and to protect others.
It was seamless, it was beautiful. They explained to you what to expect, what the jab is all about.
We encourage them to get the flu vaccine, they get the COVID-19 vaccine, and also pneumonia vaccines. The pneumonia vaccines are given to elderly people, 65 years and above, and that is just a one shot. If you're 65, you get the one shot.
The experience was wonderful. It seems like every time I come to one of these, it's great. The staff and the volunteers are excellent. They're friendly. They kind of explain things to you, which is good.
Behind the scenes, dedicated organizations have played a crucial role in making this clinic a success.
We have what is called a recovery area. In the recovery area, while they're waiting, we greet them with what we identify as comfort bags. These comfort bags contain brochures of African Nova Scotian professionals like Hair Right, for example. And we also have programs that are offered by the Department of Community Services.
Amid the hum of healthcare activities, Emmanuel Monarchy brought a spontaneous melody to life, reminding us that even in spaces focused on wellness, the rhythm of community and connection shines through.
Music is a kind of medicine on a different scale. It brings peace and quietness and makes people to reflect very well.
With many new immigrants and individuals without primary care providers facing barriers to routine health care, this clinic aims to make immunizations accessible, fostering healthier, more resilient communities.
Our community is diverse. Not everybody speaks English. Not everybody even read their own language. So we do have, you'll notice we have pamphlets in Somali language, in Arabic, in Swahili, in French. But some people do speak those languages, but they're not literate in their language, so they can't read. So we have interpreters here. So when they come in, they talk to them in their language because we want what we call informed consent. We want them to understand why they're taking the vaccines. We want them to know the importance of the vaccines. So prior to the clinics, we had a workshop, and that workshop was done in different languages as well, informing them about why they need to be vaccinated.
The mobilized unit is doing a very good job, and it seems like they get to places that people can't come to them. So they're doing really well. It's good.
The success of the clinic depends on the number of people that actually turn up for their vaccines. And not only that, because a lot of people have got immunized, because this is our last clinic for this season, but also the success is being assessed by the information. how people now react when you talk to them about vaccine. Because there was a time when you say flu vaccine, no, I don't do flu. But now that they know why it is important for them to have the vaccine, you find out that they themselves now are helping us to pass the word around, to spread it. So that's the way we measure our success.
This clinic is more than just about vaccines. It's about building trust, removing barriers, and ensuring everyone, regardless of background, has the opportunity to live a healthy life. If you haven't already, remember to subscribe to this channel for more updates. Thank you for joining us on Community Update.